So, Dr. Ammar, we will start by the station of EROTOMANIA. You have 3 minutes, okay? Okay. Okay, write down the patient's name is Kevin, and we will start within 1 minute. Kevin.
Okay.
Ready?
Yeah.
Okay, very good. MashaAllah. We'll start now. 1, 2, 3, go.
Hello, Mr. Kevin, isn't it?
Hello?
Yeah. Mr. Kevin, isn't it?
Yes, I'm Kevin. Yeah. So can I know your name, please?
Yeah, it's nice to meet you, sir. I'm Dr. Ammar, one of the psychiatrists working here at the hospital. And as I understand, I have been told that you came to ask about one of our staff nurse. So could you tell me more about this, please?
Well, she is my girlfriend. I'm not crazy. I expected that I'll be allowed to see her. I don't know why am I talking to you. I'm not happy with this conversation. I did not ask to talk to a psychiatrist.
Okay, I really understand your concern, but for the reason that you show up with unexpectedly, we need to ask you a few questions, then we will discuss your concerns about seeing the staff nurse. Is that all right with you, Mr. Kevin? Okay, thank you very much. So, first of all, I would like to ask you, do you know the nurse that
she is my girlfriend. This is a personal issue. Okay, if I came without any notification, this is totally understandable. Now you know that she is my girlfriend. I hope that you give me the chance to see her. Is it okay, doctor?
Okay, let me tell you, Mr. Kevin, that maybe I'm not in a position that just who give permission to see her, but we will discuss this in a bit. But we need, as I mentioned, we need to ask you a few questions just to understand more about what
if you are not in a position, so why am I talking with you, doctor? So this is this is a useless conversation. Why am I talking with you?
Because we really need to understand the reason of your coming here to the hospital and asking about the nurse, and then we need to speak to the nurse.
I said that she is my girlfriend. I told you that she is my girlfriend. What do you need more than this?
Okay, and how did you meet up with her?
Well, I met her in the first time I saw her. It was in the emergency room about 1 month ago. She was delivering some medical support for me. I had some sort of an injury, but you know the way she delivered this type of care. It triggered everything between us.
So I understand. And you mentioning that you are in a relationship with her, is that right?
Yes, she is
So
my girlfriend.
yeah, so you said also that the way that she react with you triggered everything. Could you tell me more? How did she react with you?
Well, definitely she was in a state. She was in the condition of being in a workplace. She didn't say anything, but you know, the way she touched me, her tone of voice, her eyes, the way she looked at me, okay, there's some sort of chemistry, definitely, and I want to take everything to the next step now.
Okay. Oh, did you think that this is her reaction, maybe a part of her job, that she might react to anybody in your place as part of her job?
Well, this is something for me to discover. That's why I want to see her, and at the same time, there's a big possibility that there can be some sort of emotional response from her. And I don't want to go through these personal issues with you, doctor, if you don't mind.
Okay, okay. But tell me, have you ever met her apart from the last time?
No, no.
This is one time just you met her. And when was that?
This was about 1 month ago.
1 month ago. Okay. And do you know any information about her? For example, her name, her email address, her phone number?
No.
Oh, okay. Did you try to see her before this time? Did you try to follow her in any way?
No, 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 no.
Okay, okay, understand. And have you ever just tried to contact her?
No.
Okay. And due to the situation that you have come up with, I need to ask you some few personal questions, if you don't mind. That
Okay.
which really might help to understand the situation. Have you been ever involved with any relationship before?
Yeah, I definitely. I had some relations in my life.
Okay. And how was your previous relationship?
Well, it was not that good. You know, some of them lost relations ended because my girlfriend complained to the police. She had a misunderstanding, you know. It was not a very good relation, actually.
Okay. And could you tell me why this relationship specifically have ended?
Well, I had some, so I have some sort of interest in my personal and intimate relations. She couldn't understand. She misunderstood my intentions, actually. I didn't want to hurt her. So she complained to the police, but I understand what she did, but actually
Okay.
it will not work like this. Any relation will not work like this.
So,
1 minute remaining, 1 minute remaining.
okay. And have you ever seen a psychiatrist before, Mr.?
No, this is the first time to see a psychiatrist.
And do you have any thoughts of just, for example, if you won't be able to see the nurse today, what you are gonna do, what you are planning to do?
No, why are you are not going to allow me? Definitely, this is my right. You don't have the right to prevent me from meeting my girlfriend.
I'm not the one who gonna prevent you, but I'm asking if you were not able to see her today.
I don't know what will happen, but definitely this will not be a very happy situation for everyone.
Okay. Okay. And do you ever drink alcohol, Mr. Kevin?
Well, everyone drink alcohol, doesn't they?
Do you take any, okay, more than usual on daily basis, for example?
Yeah, to some extent. In the weekend only. 1 minute, 1 minute, and it's over. Thank you so much. How do you feel about what you did? Doctors help Dr. Ammar. Give him your feedback in the chat section. Okay, definitely their feedback will be helpful. Pay attention to their feedback. But I want to know your own feedback about what you did.
Okay, I think this was a difficult and challenging station
Yes.
as the role player, and I tried to cover most of things, but I ran out of time. I wanted to ask about forensic history and so other things,
Yeah.
and to do more risk assessment, and to rule out comorbidity. But I think I ran out of time. That's my point.
Okay, so please, doctor, pay attention to your introduction. Your introduction, عارف الجواب بيبان من عنوانه. أنت عنوانك introduction. Okay, first impressions persist. If you are not fluent in your introduction, how you introduce yourself, you will give a very bad impression about yourself, because this is a communication skill, and actually no one has any excuse not to be good in how to introduce himself. I won't go through how we are going to introduce ourselves. I explained it on my YouTube channel, but it is a very important skill. And if you watch the recording, you can imagine how much it can affect the impression about you. You're a bit hesitant, you're not very fluent in introduction. In the beginning, you must explain frankly why you are talking with him. You don't give me the chance to ask you, why am I talking with you? Okay, so pay attention to the introduction. You started this station directly about asking about the relation. Okay, but I don't prefer this. I prefer starting smoothly, gathering some information about the patient himself, because it covers important points regarding the risk assessment and also regarding his social life. Please, doctors, mute your mics. Please, please. Okay. I'm not the one in a position. No, you are in the one in charge and in position. Don't give an impression that you are hesitant, that you are weak. Okay, no, you are in charge, you are in position, but you must say to him something now. We are not going to discuss the permission except after knowing more about your presence here, and this will help us to take the right decision. Don't say I'm not the one who take the decision. Hand movement, pay attention to your hand movement. It gives an impression that you are lacking communication skills, that you are anxious, and in the English cultures, they don't like much of the hand movement. Maximum hand movement comes from the rest. Okay, you don't. I know that you are from the Middle East. We involve all our body in the talking, even our toes. So I understand this, but in the cask, try not to use your hands too much, particularly in the online setting. I don't know if it will be online setting or you are going to Sheffield. Are you going to Sheffield?
No. Yeah, face to face.
Okay, still pay attention to your hand movement. And if it is online, it is very prominent. You see, I'm not doing much movement by hands, but online, you feel that my hand is all over the place. Okay.
Yeah.
When was that? Please pay attention to the information which I'm giving you. I said to you, I said to you that I met her 1 month ago. Pay attention. And I said 1 month, and you asked me, when did you meet her? Okay. You were not fluent. I felt that you were gathering, you were searching for the questions or the headings for which you want to check. It was not very structured. Okay, let's see the feedback of our candidate colleagues. Okay, so one, Dr. Saida, well done. Didn't have time to ask about mood, psychiatrist. Yes, there are many parts of the history. Yeah, many parts of the task were missing. Yeah, that's why this can be unstructured. And let's see according to our PDF, so which will help us to, yes, so. Bismillah. Okay, so this is the PDF, which you can have a good access to it through my YouTube channel. And if you want to download it, you can download from my site. Okay, so your introduction is very important. And the best thing from my perspective is to ask him some personal questions. As I said, it is very important to do this, to cover some important points related to the risk, and also show that you are a professional and you start this type of conversation with a defensive patient smoothly. You don't want to clash with him, actually, because you clashed with me in the beginning. You did not give me any chance except that I want to clash with you. I don't want to talk to a psychiatrist. So you put this in your mind, okay? ABC of the event, you covered it before the incidents and after the incidents and the incidents itself, but ask him if there has been a sexual arousal, and ask him before the incidents if there has been any stresses, because we know that these chaotic relationships are related also to the stresses. The psychosexual history was not covered in depth at all, brother. Pay attention to this. Pay attention to the psychosexual history, okay? I know that this is a sensitive issue, particularly for the Middle Eastern and particularly for the lady doctors in general, but it is expected from you to cover the psychosexual history, the comorbidity you did not cover, and then the impact and coping and risk. Very important to ask him with this, the routine questions, if he had any legal problems. Sometimes during stress, those can happen, like hurting himself or anyone else, okay? Routine questions, you add only to them the point of the question related to the scenario. What would happen if his request was refused? And as I always say, you must have a good time management, because you only have 7 minutes. So if you did not reach point number 5, when the bell of 6 minutes ring, leave whatever you are doing and start immediately covering the point of number 5, 6, and 7, because you only have 1 minute to cover these 3 points. Past history and family history, ask me one question about it. Okay, no problem, you covered it. But unfortunately, your termination was not that good. You should frankly say to him that it is not feasible for him to see the nurse for safety concerns, and also the authorities or the police must be informed. Okay, let's see according to this mark sheet. And again, I always highlight that whenever you are revising, whether you are using my PDF or you are using any source, make your reference the PDF, this mark sheet. It's all about this mark sheet. Your task is to score as much as possible in the mark sheet. So you identify the issues and priorities. You ask him in the beginning about this type of relation. Significance. I think this point will not be covered because there are many aspects of history we're missing. Did not cover explore enough the relative symptoms in history. Now the psychosexual history is important here, so this point also will not be scored. Risk assessment, point number 4, also will not be scored. Does not pay sufficient attention to the patient health, physical view. So this can be scored for you. Does not identify appropriate psychological or social information. You did not cover any of these, neither the psychological or the social. That's why I asked you, I highly urge that in the start, you cover the personal information. This will help you to cover the social part of this point. And later on, you can ask him some psychological information, so you cover the other point. It was not very structured. It was not formalic, but your attitude, you're very anxious. So point number 9, point number 7 might not be scored for you. Your listening skills is not good. Actually, I told you some information and you asked me about them again. Question style and question, and point 11 and 12, I think, will be scored for you. Again, this is not a pass or fail assessment. It's just to give you an impression about how to use this mark sheet and the importance of the mark sheet. Don't revise according to your personal and subjective feeling about the station. Good luck. Well done.
Thank you.
Well done, Doc. So who would like to go next?
Can I go next?
Dr. Muhammad.
Yes.
How are you, Doctor?
I'm fine.
This is the first time for you to be with us. So what is your station?
Maybe I did once with you, alcohol history, something like this. My history is fire setting.
Okay. Okay, your fire setting. I'll just put my... Okay.
So what's your name, please?
My name in the station or my real name?
No, in the station. I know you are Dr. Sam. Everyone knows.
Okay, so I will, let's see, you can choose for me any name, but I will tell you, one funny thing about this name in the real cast, because of the anxiety, if you are accustomed to practice with a particular name, you will find yourself that you are using this name in the cast. For example, if you keep using the name of Mr. Brown, which happened with me. So I kept saying Mr. Brown in all my practice. So in the cast, I couldn't get rid of Mr. Brown. So yeah, just choose different colors. Okay, so
Okay.
I opened too much. Yeah. 1 second. Okay, so not much in this. Okay.
So your name is Catherine.
Okay, let's say my name is Catherine. Okay, I'm Catherine, and you have 4 minutes to arrange your thoughts, write down your notes. We'll see how Dr. Muhammad is going to do this.
Tadi kan pusing sikit kakinya. Maksudnya bengkok sikit lah gitu. Terus terus. Okey, ni kenapa? Jangan macam ni. Umi tengok pakai sedih macam ni pun.
Okay, ready?
Yes.
Okay, very good, excellent. So we will start now. 1, 2, 3, go.
Hello, Catherine. My name is Dr. Hindia. I'm one of the mental health doctors working here.
Hello, doctor.
So I believe that you've been brought by the police because of an incident.
Yes.
But before going into that incident, can I ask you? I believe that you are living in a hostel, right?
Yes. Yes.
How long you've been in the hostel?
Well, been there for about 1 year, something like this. 1 year.
I see. And do you have any friends there?
I don't have a lot of friends in general. I don't have a lot of friends.
Okay. And what about any support? Do you have any support there? Any things that?
No, I don't have a lot of support in my life in general.
Okay. And can I ask you why you live in a hostel?
Well, there's no place for me to live other than a hostel. I've been abandoned by my family and raised by a foster family. So where can I live?
It must be so distressing for you. And can you tell me more about if your family is visiting you or seeing you at all?
No. They have abandoned me since I've been a child, and I don't know much of them, if any.
I'm sorry for your suffering. Catherine, can you tell me about the incidents? I believe that it's about setting a fire, but can you tell me more about what happened?
Yeah, I set a fire. It was a small fire in my room
Mhm.
because I want.
And yeah,
Yes,
so it was a small fire in your room. Yeah, please continue.
yes.
Okay. And when did you set the fire?
About at 12 p.m., something like this.
Okay. And was there anyone with you?
No, I was the only one.
Okay. And what was in your mind when you set the fire?
You know, I feel comfortable when I set the fire. It helps me to calm down.
Okay. And was that a spur of the moment or you planned for it?
It happened just a step per moment. I needed to calm myself down.
Okay, I see. And uh, when you said the fire, can I ask you more about what brought the police uh, for the setting? What happened?
My neighbors saw the fire and the smoke, so they called the police.
Okay. And did anyone hurt?
No,
Did you hurt?
no,
Okay. What about the property?
no damage in the property. Nothing happened.
I see. I see. And did you try to turn it off after, like?
No.
Okay. And what about your feelings after what you did? You felt like
Nothing. I don't feel that nothing. It's
didn't
not the
feel
fire.
that?
Just set fire. It's not a big deal.
Yeah, okay, I see. So you didn't feel guilty at all?
No. Why?
Okay.
Just some fire and old papers. That's it. Nobody was
And,
hurt.
and can you tell me, Catherine, before setting the fire, uh, what was happening?
Well, I was watching a documentary about the children who suffered in their early childhood, and it reminded me by my bad childhood and my parents who abandoned me. So I felt so stressed, and I know setting fire helps me to calm down.
Yeah, I can see that how stressful is that to you. And that documentary, is it reminding you with your childhood in any way? Can you
Yes,
tell me more about that?
yes, it reminded me with my childhood.
Can you tell me more about that, about your childhood?
My parents were divorced. They abandoned me. I was raised by a foster family, which they were not good with me. They were very
Okay.
physical with me, and I had a very bad and traumatizing childhood.
I- And did anyone abuse you in any way? I'm sorry, I know it's a sensitive question, but I need to understand it more.
Just physical abuse, not more than this.
Okay, okay. And this show reminds you with what
Yes,
happened, right?
yes.
I'm really sorry about what you've been through. And can you tell me more about the fire setting? How many is this the first time you set a fire?
No, I used to set fire many times before. This is not the first time.
Okay. And when was the first time of setting the fire?
This was about 4 years ago.
Okay. And can I ask you, when you set a fire, do you feel before setting the fire that you have an urge to do that?
No, just I feel that I'm very stressed, and I know that when I see this fire and things perish, this calms me down.
Okay. And can I ask you a sensitive question, please?
Okay.
Okay. Do you feel in any way that you are sexually aroused when you set a fire?
No.
Okay. And how about when you're setting a fire? After that, do you feel relieved in any way?
To some extent, yes.
Okay. And can I ask you, what is what's in your mind before setting the fire? How do you?
I just want to get comfortable, that's it.
Okay. Do you feel that there is an intrusive thought that comes to your mind to set the fire?
No, just feeling that I want something to calm me down.
Okay. And about the behavior, is there any specific thing that you need to do? How you set the fire? Is there any specific tool?
Well, just I buy some lighter and papers, and that's it. Just nothing more than this.
Oh.
Papers, mainly papers, all the newspapers, nothing more than this.
Thank you for sharing all of these informations with me, Catherine. I would like to ask you about how others describe you. Are they describe you as an impulsive person, for example?
Yeah, to some extent, yes.
Did you have a time where you feel that you are empty from inside or emotionally numb?
Sometimes, yes.
Okay. And what about your relationships with others?
Well, I don't
Is there
have good relationship. I can't say that I have any relationships. 1 minute remaining.
Okay. And how is that of the fire setting impacting your life?
Well, I had some police problems, but they were always small problems.
Okay. And can I ask you if you had any thoughts of harming yourself or ending your life in any way?
No.
Harming anyone by setting a fire?
No.
Did you take any drugs at all, like recreational drugs?
Sometimes, occasionally, but not always. No, just occasionally.
Okay. And what about using alcohol? Do you drink alcohol? Sorry.
Sometimes.
Okay. And any past history of seeing a psychiatrist, a mental health doctor?
No, this is the first time.
Okay. And thank you for talking to me. So I think that you have some problem of that setting a fire caused you some problem, Catherine. And we need to see you more to talk about that, if that's okay with you.
Okay.
Okay.
Time, how do you feel about what you did?
I don't know. I tried to cover a lot, but
it is challenging, definitely. The stations are challenging, and the 7 minutes are challenging, but you're very good. Have you ever been in the cask before?
No, this is my first time. This is my first
very
try,
clever, by the way. Very clever. You are all clever, definitely. And all what we are doing here, we want to crystallize this cleverness, nothing more. Again, pay attention to your hand movement. Please, doctors, give our doctor feedback and pay attention to the feedback of our colleagues. They are all psychiatrists, experienced doctors, and don't underestimate their feedback. Maybe they will pay
Dr.
attention to
Hussam,
something which I didn't pay attention to. Yes, brother. Yes, doctor.
I'm sorry, but I have to tell you that the cask from now on will be always face to face. There is no online.
Okay. Thank you for this information. This something, to some extent, it can be good, but it will be expensive. Okay, so So your hand movement, the urge, please, when you ask about the urge, ask if clear question to make sure that it is not an impulse control disorder. So they feel that it is an urge which you cannot control. Okay, we all have urges, but an urge which you cannot control. If you want to ask about when you start a new area, so I would like to start to ask you about if there is any other problems in any other areas in your life. Very important to signpost, because you have shifted from the problem of fire setting and you want to check the comorbidity. Now signpost by using, I would like to check if there are any other problems in any other areas in your life. Just show that you are now starting another place, because I felt that it is a bit amalgamated together. Do you have thoughts? You don't ask about, do you have thoughts of harming yourself? If you want to know, to ask her about the way she copes with the stress. You can say something like, stress brings dark thoughts of harming oneself or harming someone else. Have you ever had these thoughts when you are stressed? But when you ask her, so do you have any thoughts of harming yourself now, right now? Maybe she doesn't, but she used to harm herself. Okay, so pay attention to your question style. Delivering the diagnosis at the end, I felt that you are a bit hesitant, reluctant. You are not very, assertive in the way you give her this final diagnosis that she has a fire setting behavior which carries high risk, and also there are some borderline personality traits, and there are many ways by which we can help her. So you see, this is how you deliver the diagnosis. At the end, I felt that you're very hesitant and you're not very assertive in the way you deliver the diagnosis. Let's see the feedback of our colleagues. Start with the incidents rather than asking how long she has staying. Well, yes, there are many ways but to start the station, but as I always, Dr. Sayeda, say that it is better to start in a personal way, okay? I had these stations before, ask some information about the patient, and then ask about this part of the ABC issue. You will find a detail about this approach, but it is not wrong, okay? It is not wrong to start with the ABC directly, and also it is not wrong to start with the personal information, because eventually you will need to cover this information, particularly that this information is related to the cause of fire setting. Okay, so let's see our where is the fire setting? Okay, so this is the fire setting station. This is my approach. Still, you have the right to have your own approach, but make sure that you will cover the mark sheet in your favor. Okay, it's not my approach. It's not only my approach for the task. This is my experience, which helped me and helped many other candidates. But this does not mean that this is the only approach. There are many ways by which you can cover the station, but make sure that your reference is the mark sheet. So as I said, that you must have a plan, introduce yourself, the ABC of the event, the symptoms of syndrome. Here, the syndrome is a fire setting, the comorbidity, which must include the symptoms and signs of the borderline personality disorder, and then the routine questions about the impact, coping and the risk, past history, family history, and delivering the diagnosis. So let's see. Your introduction could have been better, doctor. Please, okay, pay attention, and you must be empathetic in your tone. This is a girl who has been brought by the police, so that this is a sensitive situation, but I'm here to help you. And in order to do this, I would like to know more. Are you okay with that? Empathy can be done by many ways, not only by the words, you can just also by your tone of voice, your attitude, which is more, its impact is more as an empathy, rather than as for empathy, rather than the words. Then the incidents, ask about part of the story in the beginning, and then ask about the incidents, what happened after the incidents and before the incidents, and in each one ask about the mental state and the factual information. Now, the symptoms of the syndrome here, there is a bit just subtle alteration because you will add some questions related to the borderline personality disorder. Okay, so that's it. No symptoms of syndrome. Sorry, so it is the fire setting. Sorry, the fire setting. And as I always, if you want to know any psychological phenomenon, you must just dissect it into a timeline points like onset, course, and the duration, and then ask the patient how does he feel, what is he thinking during the incidents, and his behavior. So you have the timeline and the points of thinking, feeling, and behavior. This will help you to gather enough information about any psychological phenomenon in depth, and definitely will help you to put this phenomenon in its right place in the nosology. The timeline, the onset, course, and the duration, and regarding the thinking and feeling and behavior during this phenomenon. Okay. Then the comorbidity here, the comorbidity, sorry, the questions about the borderline personality will be in this place. And if you have it is the rise, this is the problem in this station, that they can just forget this type of approach, or the importance of checking if this lady or this girl has a borderline personality disorder. Her relations, her impulsivity, identity, coping, childhood, emotional numbness, and so on. You will scatter these questions along her comorbidity domains, the biopsychosocial, psychologically and socially mainly. We will start by the social because it carries a lot of points related to the borderline personality disorder, and then the psychological, the routine questions, but we will add to them the emotional numbness and the abandonments. Okay. Then the impact on coping and risk. Routine questions, we will only add one question. How did this fire setting affect her life? And definitely you must ask her how does she cope, particularly the source of self-harm, because it's also related to the the borderline personality disorder symptoms. And finally, the past history, routine question, and family history, and delivering the diagnosis in the end that this girl has a high risk because of her fire setting behavior. And in between brackets, you can add also there are borderline personality traits. I did put it in between brackets because the scenario can change. These questions can be answered positively or negatively according to the scenario in the real task. Don't copy paste, please. I don't know exactly what will happen in this, what is the exact scenario in the task, but in this station, if she will have a borderline personality disorder traits, but it is not 100% guaranteed that it will be the case in the real task. They do subtle alterations. She can be psychotic. I don't know. Okay, and finally say that you need to see her again. So let's see, according to this mark sheet, again, it is very important to make your reference this mark sheet. You identify the issues and priorities. You are started by asking important questions related to her personality and also to the risk, and also the aspects of history. You covered many of them. Relevant symptoms in the history related to the fire setting, you did cover. Risk assessment. Well, I felt that you could have covered this area to some extent. Again, don't put yourself in this situation which you leave yourself for the subjective evaluation of your examiner. Make sure that it is a risk assessment station, that you cover risk in depth. Does not pay sufficient attention to the patient health. You did not ask about the psychological phenomenon. Did you ask about the depression? And so you did not ask. You ask about the borderline, some borderline personality disorder traits.
Yes, because when it's 1 minute, I moved from the social to the impact.
Okay, and then social information. The best thing, something which will help you in the time management, use open-ended question as much as possible, and try to be fluent. When you cannot imagine how much time is wasted when your sentence is elongated 1 or 2 seconds because you are simply stuttering, you know, this type of talking. So can you tell me how did this gathers at the end of the station not less than 30 seconds to 1 minute, because in each sentence you are wasting 1 to 2 seconds. And if you are going to say 30 sentences, you can imagine at the end of the station how much time is wasted because your sentences are not fluent. Okay, it was organized. It was not for Malik. Well, your communication skills are good, actually. I don't have any comments. Again, it is not a pass or fail. It is not a pass or fail assessment, just to help you to understand how to use this worksheet. Okay, very good.
Thank you, Dr. Hassam.
Thank you so much. Okay, who would like to go next?
May I go next?
Okay, Dr. No. Okay. Okay, how are you, doctor?
How are you, Dr.
شكرا على الكومنت واللايك الوحيدة اللي بتعمل.
You're welcome. You're welcome.
What is your station, doctor?
Violence risk assessment.
Yes, very important. Okay, I will share my. Okay, so here it is. Station. Okay. Yeah, for minutes, let's say that my name is Mr. Robin. My name is Robin, okay?
Okay.
Ready?
Okay.
Okay, let's.
Good morning, Mr. Robin. My name is Dr.
نبدأ الساعة. 1, 2, 3, go.
Good morning, Mr. Robin. My name is Dr. Noha Ismail, and I'm one of the doctors who work here at the Mental Health Services. To my information, you were brought to the hospital after the police brought you after an argument you had with your girlfriend, right?
Yes, and actually, I didn't do anything wrong. I'm taking my medications, and I want to be discharged. I did everything required from me. I think I ought to be discharged now.
Yes, and I'm here to help you, but I don't know much about what happened. So would you please tell me more about what happened in the argument before you got admitted?
Well, doctor, she's not a good person. I warned her several times to stop putting dirty thoughts in my mind. I beg your pardon. I don't want to say much about this, the nature of these thoughts, but they are dirty. They have sexual nature, and she didn't stop. So I decided to make sure that she understands that I'm serious in what I want to do, and that she must stop. So I just hold the knife and I waved in the air with this knife. That's it. This is what I did. So she called the police.
Well, I'm really sorry about what happened. And firstly, I want to thank you for being open and honest with me. I really appreciate it. But may I ask you whether she got hurt by the knife?
No, no.
Okay. And what were you thinking during the argument, holding the knife? What was your intention?
I just wanted to make her understand that I'm serious, because every time I discuss this with her, she makes fun of me. So I wanted her to understand that I'm serious and she must stop.
Mm-hmm. And may I ask you, how did you feel afterwards?
I didn't do anything in order to feel bad, or just wanted to deliver a message. That's it.
So you had no remorse, you had no guilt about what happened?
No, I didn't do anything wrong to feel remorse.
Okay. Do you think this could happen again, Mr.
Well,
Robin?
if she continued putting these thoughts, I must protect my mind, and she is evil. She is the one who should be blamed.
I totally understand, and I'm really sorry for the distress you're having because of this. May I ask you whether you have children at home, or is it just you and your partner?
No, only me and her. We don't have children.
Okay, and do you have a job currently?
No, I don't have a job.
Okay. Mr. Robin, do you drink alcohol regularly or occasionally?
So occasionally, yes, everyone drink alcohol. We are in United Kingdom, so what's the problem?
Were you drinking alcohol before this argument?
No.
Okay, and do you do any street drugs?
Well, I smoke cannabis, but this has nothing to do with the problem.
Yes, I just have to gather some information. And how much cannabis do you smoke?
150 ounce every week. I buy them, and I just try to end them at the end of the week. I buy again 150 ounce.
Okay. Ever since you had been admitted to the hospital, you had been receiving medications. Do you have any idea what those medications are for?
Yeah, they say that they are related to psychosis, something. Yeah, okay, I take them, and because this is the situation, I have to take them. But okay, but I need to go out. Okay, I take them because they say to me I must take them.
So you have been diagnosed with schizophrenia. Do you agree with your diagnosis? Do you accept it?
I don't have any problem.
Okay, and are you willing to take your medications when you go home, or will you stop?
Fine. I don't have any problem, doctor. I just want to protect my mind.
Okay, may I ask you some routine questions?
Okay, no problem.
Okay, don't take that the wrong way, but have you had any unusual experiences, like hearing some voices that only you can hear?
No.
Seeing someone that only you can see?
No.
Okay. You sometimes feel that someone is controlling your thoughts, your actions, your emotions.
She's controlling my mind, and she's putting dirty thoughts.
Okay.
And
You think?
Yeah.
Yeah. I'm really sorry for that. That must be difficult if your partner is doing that. I totally understand. But is there someone else that is interfering with your thoughts other than your partner?
No.
Okay. with all the difficulties that had been going, how had your mood been recently in the past few
Well,
months?
I'm very angry because she is just not stopping. That's it.
Yeah. How is your energy level?
I don't have any problem. Good.
Okay. And with all the stressors that you had been going through, have you thought about harming yourself or ending your life?
No, no. Why should I do this?
Okay. May I ask whether you have any medical illnesses?
No, no. 1 minute remaining.
Okay. Mr. Robin, do you think you can harm someone when you go home?
Well, I must protect myself. I don't want to harm anyone, but I want to protect myself.
Okay. Do you have any anything involved with the police, any charge, any convictions?
Yeah, before I had a problem because I had a problem with my girlfriend. So
What kind of
also,
problem?
we were arguing, so I threw a chair at her and she called the police.
Okay. And was she hurt?
No.
Okay. Were you admitted to the hospital before, or is this your first
Yes,
admission?
once I was admitted once under Mental Health Act.
Okay, Mr. Robin, I think from my understanding, I think you need to stay with us at the hospital for a while.
Time. Very good, excellent. MashaAllah, MashaAllah, excellent. How do you feel about what you did? Give me your feedback.
Well, I tried to remain focused the entire time to cover as much as I can and not to get lost.
Was very good, by the way. Though you missed something related to his social circumstances. That's why I would like always to start with this personal approach. It will help you to cover important parts in the history. But all in all, it was good. Okay. If he's had any stressors, anyone around to support him. Okay, that's it. All in all, it was good. So let's see. I didn't write anything in my feedback because it was very good. I hope that let's see the feedback of our colleagues. Pick up the cues, putting thoughts, protecting myself. I think she asked this, Dr. Nasser. She did check this. Let's see the feedback. Okay. Again, doctors, you don't owe to follow this is my experience. If you have any other source, it's okay. But eventually make sure that you cover the mark sheet in your favor. Make your reference the mark sheet, not the source. So introduce yourself in a very good way and just ask him about that, the cause of the setting that he wants to be discharged, okay? And ask him in the beginning, about the cause of admission. This is my approach, starting to have this sort of personal information, but it seems that all of you is not okay with that. It's up to you. But this has really helped me in the beginning to start the station smoothly and absorb the defensive attitude of the role player. Okay, and then start the incident assessment. Ask him about the cause of admission and ask him about his part of the story and assess the incidents in the ABC manner, which you did, the symptoms of the syndrome. I really don't like this question, the routine question, and ask him about going through the psychosis. And say, just pick up the story. He feels that his girlfriend is still putting thoughts, so they feel that this girlfriend is still putting thoughts in your mind. Anyone else is doing this. You've been through a lot of stress that this makes you feel have any unusual experiences like hearing voices or seeing things which no one else can see. So pick up that you use the weaving technique instead of asking, I'm going to say unusual routine questions. I don't like it. And I don't think that the examiners will also like it. Use the weaving technique. There are many things in the story of the patient which will help you to start checking the psychosis without saying that I'm going to ask you routine questions, okay? You check the mood, you check the insight, you didn't check the anger. Pay attention that he has anger issues. Okay. Pay attention to the anger. Comorbidity. You do not check the social issues. Actually, the only, but still, I think that the social part of the mark sheet can be covered for you because you ask some important questions related to the social issues, like having children at home, if there is anyone else, if he has a job. There is a point for the social information, doctor. I did not put the social information and questions about the social information for nothing. And actually, this is a blind area for the candidates. They don't feel that they should ask about it, though it is part of the mark sheet. The impact and coping and risk, you covered it. And past history, you covered it. You asked about the admission under Mental Health Act, very clever. And then just say it assertively, okay, because there are a lot of safety concerns. It will be better for him to stay in the hospital, okay? Let's say it assertively. Thank you for all this information, but there are a lot of safety concerns. Just say something in this context in a very assertive way. So let's see the mark sheet. You identified the issues and priorities. The aspects of history, you covered them, very good. The aspects of history are the information in the candidate's notes and also the headings of the points which should be covered in the history. The relevant symptoms in the history, yes, the psychosis, adequate skills and risk assessment, you covered them. Yeah, let's see, did you cover the history? Thoughts of harming himself or anyone else, using recreational drugs, you asked them. Did you ask about the police charges?
Yes.
Okay, very good, very good. The psychological and social information, everything was good. Regarding the communication, everything was good. Very clever, Doctor. No, very clever.
Thank you.
You are very clever, mashallah. So
Thank
let's
you.
see the next doctor. Who would like
Yeah,
to
I'm the
go?
next.
Nasser or who would like to start?
No, I'm the next. Joshua.
Okay, Dr. Joshua. You have two doctors who wants to start. Dr. Joshua. How are you, doctor?
I'm okay. Doing good.
So what is your station, dear Dr. Joshua?
Abusing learning disability.
Can you just raise your voice because the voice is very feeble? Please raise your voice or approach to the
Abusing learning disability.
Abuse and learning disability. Okay.
Yeah. Abusing learning disability.
Yeah. Okay, brother.
Yeah.
Okay, Dr. Joshua, you have 4 minutes. Okay.
All right. So what's the name of the key worker?
Okay, let's say that my name is Mr. White.
So why?
Yeah.
All right.
Ready?
Yeah.
Well done. Okay. I will start. 1, 2, 3, go.
Hi, is it Mr. Y?
Yes.
And that is Charlie Brown's key worker.
Hello. Yes, yes, yes.
All right. So I'm aware you're here today to raise some concerns about Brown's health. I'm happy to have a chat with you.
Well, thank you so much, doctor, that you came, because the behavior of Charlie has changed dramatically over the past 2 weeks, and we really need to discuss this with you.
Okay, that's fine. So what has happened in the past 2 weeks?
Well, actually, you know, he became withdrawn. He has changed in his behavior. He used to be very happy and playful. Now he has changed a lot, doctor.
Okay, I see. That must be very dramatic. Apart from this withdrawn nature, have you found Charlie crying sometimes?
Well, not crying, but he is withdrawn. He is frustrated sometimes. You know, he shouts. He used to be very cooperative with the staff. Now sometimes he pushes them.
Okay, is he aggressive in the care unit as well?
No, not very aggressive. Just if they want to push to help them, that he pushes their hands, but he's not aggressive. He's not cooperative.
Oh, I see. Has he been exhibiting some self-injurious behavior, like hitting himself and all of that?
No.
Oh, I see. How about some sexualized behavior, like masturbating in the public?
No.
Okay. You mentioned that all of this started 2 weeks ago. Can you remember what happened around that time?
Well, actually, nothing happened except that he goes back home and he returns back to our place. But we noticed that there has been some injuries in his body, and since then his behavior has changed.
Oh, he was back at home 2 weeks ago, and when he was coming back,
And he came back with these injuries.
okay. And where were these injuries? Where were they located?
Well, in his back and shoulder.
Okay. Did you take note of the shape of the injury? What did it look like?
Well, yes, just like the shape of the palm. That's it.
I see. And what color did he take? Was it purple or red?
No, red.
Oh, I see. So when he was coming back from home, did he look disheveled? Had he lost some weight?
No, he didn't lose any weight. No.
Okay. Oh, I see. Are there any concerns with Charlie's physical health? Are there any?
Well, there has been some concerns about 1 month ago because he has seizures, but the doctor has changed for him the medications, and since then he stopped having these seizures.
Okay. So the seizure has been well controlled in the past 1 month.
Yeah. No seizures for 1 month. Yeah.
Okay. And he's not on any medication at the moment?
No.
Okay. So we can say that is possibly from an adverse reaction from the medication. Okay.
Yeah.
And so let me know, how is home like for Charlie?
What?
How is home like for Charlie? Who is at home with him?
Well, his family, I think he has a mother and father and a couple of siblings, but I don't gather more information right now about his family.
Okay. Do you know if they have been supportive of Charlie?
What? Raise
Do
your
you know
voice.
if they have been supportive?
If he is what?
If they have been supportive of Charlie?
If they are taking care of.
Family members have been supporting him.
Spotting him? What do you mean by spotting?
If they have been giving him enough support at home.
Support, yeah. Well, there haven't been any comment on their support, so I cannot say anything positive or negative regarding them.
Okay. Now, does he have any recreational activities like play activities at home?
Yeah. There are some activities in the place which can help them. Yeah, usually he used to be engaged in these activities, but now he is not.
Not okay. What is his level of communication? How much can he communicate?
He can hardly talk, doctor. He can hardly talk. We understand that he needs support in everything, but he used to be very cooperative and playful, but now he is not.
All right. How about his skills? What level of skills does he have?
What do you mean by level of skills? He is diagnosed
Has he
by
got any,
moderate to severe.
vocational activities like what?
No, he doesn't have any vocational activities.
Okay.
Just the daily activities.
Oh, I see. So you mentioned that he comes from home. Have you made any inquiries from the parents?
We tried to communicate them, but we tried to communicate, but nobody answered actually. We tried many times to communicate them, but nobody answered.
And they didn't bother to reach out to you?
What?
And they didn't bother to reach out to you, even though you tried to communicate them?
Nobody, we tried to communicate them, but they did not respond. 1 minute remaining.
So I see from we've talked a lot about Charlie, and from our discussions, I can infer that these injuries was noticed right after he came back from home, and at about the same time, he began to feel withdrawn and all of that. So it is possible that Charlie is not getting enough support at home, and it's possible that he's been abused, given that the mark you saw on his back was the mark of the hand. He may have been beaten at home and all of that. But it would be necessary to reach out to the parents and get more information as regards that. Okay.
Okay.
Yeah. Thank you very much.
Thank you very much.
Okay,
very good. So how do you feel about what we did?
I did not try.
I didn't try it much because I was trying to hear you. So
I'm so sorry. Not good for my device.
Sometimes pay attention to. Well, anyway, you will not have an online setting next time, so no problem. But the voice was not clear. So how do you feel about what you did? I hope that our colleagues give him some feedback. It will help me also to assess him. I was busy trying to hear them, so let's see. Okay, so let's see, how do you approach the station? Now you have two problems here, that he has injuries and he has also disturbed behavior. So you want to, in both, these are the two complaints. There is no particular syndrome like post-traumatic stress disorder or schizophrenia or borderline personality disorder. There is no particular syndrome which you want to check the specific symptoms, but there are two complaints here which you need to cover: the behavior and also the injuries. So the behavior, the first thing that you want to show empathy, and as we always say that introduction, I'm not going to go through the introduction again, but the complaint, start by empathy, okay, and ask him about his current situation. I would like to know more about his behavior. What is his diagnosis? Is he able to express himself? Is he able to take care of himself? The situation, which is the current situation. Since when did you start taking care of him, this caregiver? How was his behavior during this period? Okay, can you tell me more about the behaviors which are worrying him? So there is a particular disturbed behavior. So what are these behaviors? These behaviors are not given in the candidate notes. It is a request which is sent to you that he has a disturbed behavior. So what are these behavior? Can you give me examples? Any aggression or sexualized behavior? So this is something which is very important to be asked, that you want to know exactly what are these behavior, and you should stress on some important behaviors in this context, like the aggression or sexualized behavior. Okay, and then ask him about the onset, the course, the duration, the onset. When did you notice that these changes? He will say 2 weeks ago anything happened, and this time he will talk about the injuries ask a couple of questions about the injuries and go back to the behavior. When you hear some important information and at the same time you are checking something which is also important, what do? Do you just leave what you are doing and go after this important information and forget about what you have been doing? No, do something called signposting, ask 1 or 2 questions about this injuries and then go back to the important issue, which is the main which you have been referred or the request is about, which is the behavioral problems. You can say, so yes, tell me more about these injuries. When did this happen? And I can see that this is an important issue, but I would like to check the behaviors and then I will go back to these injuries later on. And then ask about, is this particular behavior is increasing? What makes it worse? What improves it? And ask him, frankly, what is your explanation? Whenever you are talking with someone who is giving any type of medical care, show that you are professional. So what is your explanation as someone who has been giving care for this patient for a time? Definitely your perspective is important. Show that you know how to talk with a colleague, okay? And ask him about, before the onset, ask him if this has ever happened before, okay? So this is how you assess the behavior. And then ask about the injuries. Likewise, when you assess the injuries, check the current situation, okay? The types of injuries, if there has been bruises, lacerations, and if there are any injuries in the private parts, very important, okay? Ask about these injuries or stains in the underwear, okay? Very important. And you ask about the shape of the injuries and pay attention, check the stick or palm. You show that you are professional when you talk about the injuries, okay? You want to know when did these injuries happen, and there is a close temporal relation between the injuries and the disturbed behavior. And ask about the cause. So did this patient has sustained injuries or did it happen once? And ask him before the onset whether this has been happened before or no. We know that one of the important points in the history taking or history is the symptoms of the syndrome. There is no particular syndrome here to be checked, okay, but there are important issues in the comorbidity, okay. Ask him about the mood, the physical, okay, condition of the patient, if he has any hearing or visual problems. Why are we asking about the physical? Because sometimes those who have the learning difficulties, they can have also challenging behavior if there is an underlying pain. They cannot express themselves. But we can pick up the reason if we check the physical condition of the patient. So how was his physical condition? If he has any visual or hearing problems, he has all. You check the seizures. Ask him if there is any pain while eating. The toothache is very common in the patients who have mental problems, mental learning difficulties, and pain during micturition and defecation. And ask him if he points at any part of his body. So sometimes these patients just point to the parts, which, if you have ever been in contact with any type of these type of patients, sometimes they point to the areas which is painful. And social, ask about the social, very important. And all this comes under the heading that if you must make it clear that I would like to check if there are any other associated problems and what could be the possible causes for this behavior. So this is how you signpost for the comorbidity. You're not just checking if he has any psychological or physical problems. You want to know more if there can be a reason for this challenging behavior from the psychological, physical, or the social context of the patient. Very important to check if there is any risk, because we know that these particular type of patients, sometimes they hurt themselves, they bang their heads, okay? It's not only that they hurt anyone else, sometimes they bang their head whenever they are stressed. Okay. Past history and family history. There's no place for this actually, and just ask him at the end, say that you want to see the patient yourself, and then you want to check the physical, psychological, and risk issues. And also you need to contact the safeguarding bodies. Okay.
Thank you very
good.
much.
Okay, so
Thank
let's
you.
see let's see the feedback of our colleagues. A lot of questions were asked that were mentioned in the task. I don't understand your comment. I don't understand. Okay, so let's see. This is the feedback of one of our colleagues, so I don't know exactly what did she mean. Okay, so let's see the feedback again. This is the last time I'm going to go through the mark sheet because of the time issues, but always pay attention to the mark sheet. Does not identify issues or priorities. You ask about the injuries, you ask about the behavior, is okay. Recognize aspects of history. Unfortunately, there are important aspects which she did not cover, like the psychological and the social. So most probably this point and the last point are not going to be covered for you. Does not elicit and present or explore in enough details relevant to the symptoms of history. Now, here there are important points related to the behavior and the injuries itself that you should dig more in these areas, which I did not feel that you covered them enough. Risk assessment, well, he did not cover this. Patient health view, here it is not the patient health view, but the role player. That's why I urge that when you talk to someone, whether he is a role player or playing the role of the father or the patient or the caregiver, so ask him, so what is your explanation? Okay, well, how do you feel about what's going on? In order to mark for yourself this point, because they have different approach from, if you are from the Middle East or from the Far East, we are usually authoritative in our approach with the patients, but they don't like this type of approach. So the candidates who are more cooperative, who are more collaborative with their patients, and what they want to hear their perspective, they give them an extra point. It was not very organized, otherwise everything related to your communication skills are good. Very clever, doctor. Okay, this is not a pass or fail. It is just to help you to understand how you are going to be assessed. Okay, so thank you so much. Who would like to go next?
Yeah, me, Dr. Hussein. How are you?
Assalamu alaikum. How are you, Dr. Nasser? Good luck.
Alhamdulillah.
Alhamdulillah, mashallah. So what is your station, doctor?
Indecent exposure.
Exhibitionism, it is the exhibitionism.
Yeah.
1 minute. Yes, I will just put it in my.
Okay.
Okay. So this is the exhibitionism station. You will have 3 minutes. Write down your notes, arrange your thoughts.
Name of the patient, Mr.
Let's say my name is Michael. Michael.
Okay. Okay, ready, Dr. Hussein.
Ready? Okay, mashallah. Yalla, shatar. 1, 2, 3, go.
Hello, Mr. Michael. I am
Hello.
Dr. Gabriel, mental health doctor. I
Hello.
understand that. Hello, I understand that the police brought you here, so I would like to discuss with you regarding
I
the nature.
didn't do anything. I shouldn't be here, doctor. The neighbors misunderstood everything. I didn't do anything, actually.
Could you tell me why the neighbors misunderstood? Could you tell me
They
what
claimed that
actually?
it was a very, very embarrassing situation, doctor. You know, being cuffed in front of all the neighbors with these allegations. I don't know how come they can do this, though.
I am really sorry that you are feeling that. Could you tell me what is actually happened in front of your neighbors?
Well, actually, I didn't do anything. Actually, why do you? Why are adopting their story, doctor? I didn't do anything. They claim that I did a bad thing and I exposed myself. Actually, I didn't do anything.
I would like to know
Why a neighbor can do this to his neighbor? We should be better with each other.
I can see your point of view, but I would like to hear the story from your point of view. Is that okay with you?
Yeah, no problem, no problem. So I was, you know, I was in my house, doctor. I didn't go. I was in my house. Sometimes, you know, I'm in my house, alone in my house. So I was. Well, sometimes I feel that whenever I'm stressed, I prefer to be, you know, without any limitations, anything which is restraining me, so I don't wear anything. But in my house, unfortunately, there was a window which was open, and they claimed that I intentionally exposed myself to them. They were sneaking at me. I didn't do anything.
So you are expose yourself in your window inside your house?
No, I did not expose myself. They looked through the window to me, at me. So I did not do this intentionally.
Where you stand actually? You do stand behind the window?
And I don't remember actually, but it seemed that the window at their side in my house was open, so they saw me.
So did you expose yourself totally, or?
Well, I didn't expose myself. I was in my house.
Yeah. Did you notice your neighbor before exposing yourself?
I didn't notice that anyone is watching me. I didn't notice anything like this.
So, and you mentioned that you feel stressed before that.
What? Yeah. Whenever I'm stressed, I feel that I need to be like this, and that's it. So I'm in my house.
It is usual for you when you're feeling depressed to expose yourself.
Yeah. This is not the first time.
Yeah. I would like to ask you some personal and sensitive question to help you regarding the nature of allegation.
Yeah. Okay.
At the time when you're inside your house, did you watch your neighbor also watching at the time, or you didn't see them?
What?
Did you see your neighbor when you expose yourself, or you didn't see them?
No, I did not see them, no.
At any chance that you are under influence of alcohol?
No, I did not take alcohol. I did not take anything.
Did you felt any pleasure at the time?
No.
Or any sexual arousal? Or
No.
erection?
No.
And what happened after that time?
After that,
Mr.
nothing
Michael?
happened. I found the police at the door, at my door.
Yeah. So, Mr. Michael, you mentioned that you are feel the distress. Could you tell me more about your mood recently?
Well, I'm very frustrated. My wife left me 6 months ago, so I'm living alone. Definitely, I will not be happy.
Are you able to look after yourself?
Yes, no problem.
Are you eating okay?
Yes, no problem.
Do you, at any chance that sometimes people, when going through stressful time, may sometimes hear voices or noises while no one else around? Is that happened for you?
No, no, no.
Mr. Michael, you mentioned that it happened before.
I didn't say that. It happened before, no, but I didn't say that.
Do you have
What?
a similar problem in the past?
Yeah, once in the other city, and we had to move to other city, and actually my wife left him. Also, what was a misunderstanding. You know, this is something which is very personal. This is the way which I personally feel comfortable, and it seemed that many people misunderstand this.
At that time, do you have problem with the police regarding this problem?
Yeah, I had some, but there was no legal problem, just charges, and everything was dropped.
Okay. Mr. Michael, how do you cope with all of this?
Well, this is the only way which helps me to cope. That's, you know, moving around with my behavior. Like, this is my behavior.
Some people cope by drinking a lot of alcohol.
No.
Street drugs.
No. 1 minute remaining.
So, Mr. Michael, have you seen a psychiatrist before?
No, this is the first time.
You mentioned that you are living in your house alone. Do you have any contact with children?
No.
So, Mr. Michael, when you are going through a difficult time, at any chances that you have any thoughts to harm yourself?
No.
Or anyone else?
No.
So Mr. Michael, I can see that when you're feeling distress, you sometimes expose yourself and you didn't plan for that and you accidentally watch it by your neighbor. Let me sometimes to gather more information to find how we can help you.
Still have 16 seconds.
Okay, thank you, Mr.
Finished.
Michael.
Okay,
Yeah.
Thank you. So how do you feel about what you did?
I tried to go with ABC first.
Yeah, very
And,
good. But you missed the psychosexual history. Tell me more about your relation, your sexual life. This is very important. At least if you cannot cover it, all of it, at least just go through it rapidly. At least if his name is the sexual offender register, how do you describe your sexual life? Are you sexually interested in anything other than an adult female? Just a couple of questions, 3 questions maximum. If you don't have time, but you did not assess this important part of the psychosexual history, because it's all about this deviated or pervert behavior in his life. Okay. So nobody gave you any feedback. So let's see how. Yeah, let's see the feedback of our colleague. He repeated some questions. Yeah, I felt empathy was lacking. Unfortunately, Dr. Joyce, the problem with empathy is a major issue with the candidates whose English language is average, because they can hardly, you know, gather sentences, and they miss this reciprocal emotional interaction. Okay. Okay, so let's see how we can do this according to the mark sheet, according to the PDF. Here's exhibition. Okay, doctor. So this is the exhibitionism. Again, doctors, you are not obliged to follow my scheme, but make sure that eventually the mark sheet is in your favor. Okay. Introduction. Again, doctors, in this type of stations in which you have a defensive person, start by knowing it starts smoothly, because pay attention to the instructions though. What does it say in the instruction? Okay. You are not willing to be cooperative except later in the interview. So the more the candidates have the communication skills, definitely the role player will be, you know, the duration of this defensive or non-cooperativeness will be less. Okay, so start smoothly. It will show that you have good communication skills, some information about him before going through the exhibitionism details. The ABC of the event, I think you covered them. Then the psychosexual history, unfortunately, this is an important area which you did not cover. You covered the psychological, you covered the impact, coping and risk, the past history and the family history. Eventually, the delivering of the diagnosis, you can say something like, there could be a psychological problem behind these allegations. This problem is, we call exhibitionism, okay? You can say it like this, okay? There is a better way to deliver the diagnosis at the end, okay? From our discussion, there could be a psychological problem behind these allegations. I think behind this behavior is better than behind these allegations. Behind this behavior is better to say it, because this means that those who did this, the allegations, have a problem. Behind this behavior, okay, and this problem we call exhibitionism. Okay. Other than this, everything was okay. So let's see, according to the mark sheet, you did recognize the issues and priorities, which is the first time, which is the information regarding the candidate notes and the information and the major headings of the history taking. Your priority definitely is the the priority is the exhibitionism, the aspects of the history, the information in the candidate notes, and the major parts of the history taking task. And then you check the symptoms. Unfortunately, this is the area, the point in which you should cover the psychosexual history in details. The risk assessment you did cover, the patient health view, I think you covered this. Psychological, and so did you cover this? So you did not cover any in social information, so most probably this point will not be scored for you. Your consultation was not formalic, and you could, yeah, actually it was organized, but again, doctor, so there are 2 points which will be missed here. So your communication is good, which are related to the language, as one of our colleagues have paid attention to the questioning style and the language in the context of the scenario. Unfortunately, this is not very fair for those who English language is average, but the only way by which you can overcome this problem is to write down the sentences which you are going to use, the questions which you are going to use in the task. In the beginning, you will find that you are writing too much, but later on you will not write anything, because you will find that you are using the same questions more and more. Okay, but well done, doctor, very clever. Thank you so much. Okay, who would like to go next?
It's Dr. Imam, but it seems he's not here, so I can do my station.
Okay, Dr. Zainab, is it right?
Yes, sir. Yes.
How are you, Dr. Zainab? I think this is the first time for you. For what? So what is the station which you want to do?
Wandering risk assessment.
Yeah, wandering. Okay. Again, this is one of the bad stations. Okay, you have 3 minutes. Write down your notes, arrange your thoughts, and listen how you are going to do this station.
What is the name of the daughter?
Let's say that her name is Paula. Paula.
Paula.
Paula. Ready?
Okay, I'm ready, sir. Yes, sir.
Okay, let's see how you're going to do this. 1, 2, 3, go.
Hello, Miss Paula. I'm Dr. Zainab, one of the mental health doctor. How are you doing
Hello.
today?
Well, I'm very worried about my mother because the police called me that she is wandering again, and really, stressed because of this issue.
So I understand that your mother had been admitted because police has found her wandering on the road.
Yes,
And
yes.
what I wanted to do today is to ask you some question about your mother, like how she was prior to this admission.
Okay, no problem.
So could you share with me about how you have found your mother recently, Ms. Paul?
Actually, I'm living in another city because of my work. I had to move about 2 months ago. So, but I visit her regularly, and there are cameras inserted in the house, which makes me check her frequently. So everything is okay. I'm making sure that she has food, but sometimes she leaves the house.
So apart from this time, was similar kind of incident happen in the past?
Well, this is not the first time for her to wander. Actually, it happened maybe several times, but the first time was about 1 year ago.
Okay. So if so it happened, so have you used any safety measure like wearing any ID necklace or anything?
I was living with her, so I didn't do anything, but I think so. We had just, we didn't take any measures. That's actually,
Okay. And I understand from the notes that she is having dementia.
yes.
So I just wanted to ask something about her memory difficulty. So
Yeah, no
when
problem.
did you first notice the changes?
It was about 3 years ago. She was diagnosed with dementia.
And what sort of things does she tend to forget?
Well, she's more forgetful for the recent events. Something happened half
Mhm.
an hour, but she's very, very good with all the events.
And how quickly did that problem appear? Was it sudden or gradual?
No, it is very gradual. Actually, her memory is deteriorating very gradual. Actually, we hardly noticed it.
And has she ever forgotten where she is or who she is?
No, no, no.
Okay. And as you mentioned that her short, she remember what happened like few years back, but she has difficulty to remember what happened like recently, right?
Yes, yes.
I was just wondering how is she coping with her memory problem? Like, has she ever gotten aggressive or irritable?
No, no, no.
And okay, and has she ever put herself into danger due to her memory problem, like maybe putting the gas on or letting
No,
any
no.
strangers to her home?
Only this wandering. She leaves the house, and that's it.
And how has this impacted on her mood?
So sometimes I feel that she doesn't care.
Have you ever seen her tearful?
No, no, no.
Okay, and is there anything that she's enjoying at the moment?
Well, I don't know. Actually, I feel that she is bored. No, there is no lot of activities around her.
And how has she been sleeping at night?
She's sleeping good. She's sleeping good.
Okay, does she eat regularly?
Yeah, yeah, yeah.
Does she have any problem in swallowing the food?
No, no, no.
Okay, and what about her daily activity, like taking care of herself? Is she able to do these
Yes,
activities?
she's able to go to the bathroom.
Okay. And has there ever been any history of any family member having memory problem?
No, no.
Okay. And do you think, apart from dementia, does she have any other medical problem that I should be aware of?
No, no. We last checkup, medical checkup was done 4 months ago. No problem.
And have you ever noticed any changes in the way she walks?
No, no, no.
Okay. And any history of fall at all?
No, no, no.
Okay. And have you, like, is there any problem with going to, bathroom or?
No, 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 no.
Okay. Have you noticed any change in the way she talks at all, like communicating with family members?
No, no, no.
So, have you noticed any changes in her personality recently? Maybe becoming very aggressive at times.
No, but she's not very sociable as before, and sometimes she says things and behaviors which are not suitable for the situation.
Mm-hmm. Okay. Okay. And in terms of managing her own money, is she able to do that?
No, no, no. I manage her finances by myself. Otherwise, she cannot manage the finances at all.
Mm-hmm. What about driving? Does she drive on her own?
No, no, no. She doesn't drive.
Okay. And what about how is she coping in general? Does she take alcohol or any other street drugs?
No, no.
And
1 minute remaining.
okay, and this question might sound little strange, but have you noticed when you visit her, have you noticed any unusual thing about her, maybe talking to herself or responding to
No,
something that aren't
no,
actually there?
no.
Okay, that's good. Okay, and have you seen her expressing any thoughts of maybe ending it all?
No, no, no.
Okay, so thank you so much, Ms. Paula, for talking to me. So I was just wondering, in this situation, how are you coping?
Well, I don't know what to do, doctor. I'm living in another city. I'm the only daughter for her. She doesn't want to come with me to my new house, and she is wandering from time to time. And I really want to take her back home with me to my new place, but I don't know what she will do. She doesn't want to stay in this new place.
So I can understand, Ms. Paula, it must be difficult for you to handle this situation. And currently, she's living alone and she don't have any support at home. So I don't think it is safe. I mean, according to the assessment, I don't think it is safe to leave her
Time.
alone.
How do you feel? How do you feel about what you did? Give me your feedback, and please,
I
doctors,
wanted to complete.
give her some feedback, doctors. Don't be mind.
I just wanted to complete that it is not safe for her to live alone.
Okay, so the good thing that I feel that you know everything, but pay attention that you must do what is known as signposting to make just to highlight that you are in a new part in the history taking, because you were just posing questions. And I know that you are checking another area, but it was bit amalgamated together. When you use the signposting, something like, I would like to check if she has any other problems, and check the psychological and the physical, and then in the beginning, and check, I'm worried about her, and check the risk factors, and then check the past history. And this is how you do the signposting before starting a new area. Just make sure that you signpost and show that you are checking a particular area. Number two, it is all doctors. This task is mainly about your communication skills. You have been already assessed regarding your information, so show empathy, because in the beginning I showed you that I'm worried about my mother and so on, and I didn't feel that you have any empathy with what I was saying. So let's see how we can do this station according to our PDF. Again, doctors, don't make my PDF is second PDF. You have your own way of doing things. You can have another source, but eventually it's all about the mark sheet. Okay. So the first thing you should do, doctor, is to assess the problem of the wandering, because it is not an incidence. This is a behavior which you want to assess. Okay, so you want to know the onset, the course, and how was she doing before the onset, okay? When did this start? Anything happened at this time, like medical problems, or was she confused when she wandered? So we want to know exactly when the onset or the wandering happened. What was the circumstances? What were the circumstances? And then the course, Is it it is increasing, and what makes it increase, like boredom, hunger, or pain? Anything prevents this from happening, like any activities or someone living with her? What happened in the previous wanderings? Was she hurt? Was she, or did she get back home? Any steps taken to prevent this from happening? And then ask her about before the onset. You want to know how was she doing before the onset. So suppose that she started wandering 1 year ago. How was she doing before that? Okay, has she ever wandered before? Did she have any physical problems, any had trauma, any depression? And ask about the health style, lifestyle, if she has been a type of person who has not, sedentary type of life. Okay, so this is the complaint. And then your symptoms of the syndrome signpost. I've got that she has been diagnosed with dementia. I would like to know more details about her memory problems. How would you describe her memory problem? Is she more forgetful now for the recent events? Can you give me some examples and assess the symptoms of the syndrome according to our acronym, the LOVE map? The comorbidity, again, when you check the comorbidity signpost, I would like to check if there are any other associated problems, psychological, like depression, or depression has been assessed before. So if she has been having any unusual experiences, and if she has any physical problems, and very frankly, ask her about the social circumstances. Very important, doctor, to ask her about the social circumstances. I think you missed this. Did you ask me about her social circumstances? Did you?
No, I forgot to ask.
Okay. And when you ask about the risk, again, signposts, say sentence which will show that you are going to check the risk. I'm worried about her safety. Are there any concerns regarding her safety which you'd like to share with me? And go through the A, B, C, D, E, F, G, like agitation, aggression, B, the bathroom, C, cooking and feeding herself, D, for driving, E, electrical devices, F is very important, falling, fire setting, and financial issues. Okay, and ask her, this is a very important question, in the impact and coping, how is the family is coping with all this? You will find that there is no coping. We don't know how to sort this out. That's why your decision at the end you must propose that she might need to stay in a nursing home. Ask about the past history and the family history. If she has been in contact with psychiatric services, or any family member has been diagnosed with dementia, or contact with, this is a routine question. And at the end, say that she is in need for staying in a nursing home. If she argues against this recommendation, and this is what is expected, they want to challenge your communication skills, you can just develop discrepancy. You can say to her that there are a lot of concerns about her safety, and at the same time, there is no one around her to help her or to cover her needs. But at the same time, you want to take her back home. Do you feel that this can be the best decision, or where does this leave her, something in this context? Okay. I'll not go through the mark sheet. Okay, I need to take some rest, and then we will continue the rest just to pray, and I will come back after 10 minutes. Well done, doctor. Well done. Okay.
Thank you, sir.
After 15 minutes, doctor, we will resume our assessment. Hi, doctors. I hope that you are all fine. Okay, so who would like to go next? We have 4 stations left. Yeah. No, excuse me.
So I would like to go next for vascular dementia.
Is it your turn? I don't know. Is it?
It's
You
the
have,
turn.
you have booked this station, doctor?
My station is station 9. It's the after the wandering assessment of dementia.
Yeah, yeah. So
Vascular
your
dementia.
station is vascular dementia. Okay. That's
Yeah.
good. So I will put it on the screen so you have a good look at it. Okay, and you have 3 minutes. Arrange your thoughts, write down your notes. You'll see how you're going to do. Can I have your good name? Is it Dr. Jatin?
Jatin.
Jatin, okay, Dr. Jatin.
Yes.
You ready?
Yes, yes, sir. Ready.
Okay, very good.
Hello, Mr. Joseph.
Yeah, 1, 2, 3, go.
Hello, Mr. Joseph. I'm
Hello,
Dr.
doctor.
Jatin. I'm Dr. Jatin from Mental Health Clinic. I'm a specialist in memory clinic here. I read from your GP notes that your father has certain memory issues. Can you
Yes.
something about that?
Yes, he became very forgetful, doctor, lately, and discuss this with the GP. He said that I must discuss this with you.
All right. So what kind of forgetfulness he's having?
His memory is very poor, doctor. He forgets when he asked a breakfast for breakfast, though he has just taken his breakfast. He nearly loses everything. He owns keys, wallets, everything. But
So besides recent memory losses, is he having also the long-term problems? For example, forgetting the past things? What happened months back, years back?
Strangely, he's good with the past history, with long-term memory issues. So he remembers quite well his marriage. He remembers quite well his school days.
Okay. So when he's you're saying that he's having recent memory losses, is he also having problems in recognizing what day it is, what time it is, where
Sometimes yes, sometimes yes.
Sometimes it happens. All right. Is he also having problems in communicating? For example, difficulty in finding words or recognizing what other person is
Yes.
speaking?
Yes.
And is there difficulty in recognizing things? For example, common objects or people?
Sometimes yes. This also happens.
All right. And is there any difficulty in using certain tools like mobile phone, laptop?
Yeah. He used to do things. Now he used to do some handcrafts and use the tools. He likes this type of things but now he's not able to do them.
And Mr. Joseph, these problems of memory, when did it start actually?
It started about 1 year ago.
And did it start on a very particular day, or did it start over the period of time?
Well, he went to the hospital. He had to go to the hospital, and after going to the hospital, he came back. After 2 weeks, he was okay, but everything was okay. But we noticed that he's a bit forgetful. This is the time which he started to change. His memory started to change.
And do you remember the reason why he went to hospital during that time?
Yes, he had a stroke at this time.
Okay. And since then, has his memory problems increased over the last 1 year, or has it remained static?
Yes, it has increased at this time. Yes, definitely. His memory in 1 year ago definitely is better than now.
Okay. No, I'm asking that the memory problems that he had after 2 weeks of hospitalization and over the last 1 year, has he deteriorated further?
Yes, definitely it has deteriorated. Yes.
And this deterioration has been gradual or a very stepwise manner?
What do you mean by stepwise manner?
I mean that for 3 months he was at a particular level, and then after suddenly 3 months after a particular point of time, suddenly there was deterioration. Then for 3 months.
We noticed that whenever he goes to the hospital for admission or for any medical problem, he goes out of the hospital with more memory problem.
Okay. And how many times this has happened in the last 1 year?
Maybe 3 or 4 times. He had a lot of medical problems.
Okay. Can you share with me what other medical problems he's having?
He has heart problems, high blood sugar level, high blood pressure.
And has he been taking treatment for all these things?
Yes, but unfortunately still having, sometimes these things are not controlled.
Okay. All right. And Mr. Joseph, I'm sorry that your father has been suffering so much, and of course the family has been suffering so much. But I would like to ask whether there has been any difficulties in performing activities of daily living.
Well,
For example,
not that much. He needs some support sometimes, but not that much actually.
not that much. So he can travel on his own, call someone on his own, take care of the money.
No.
He cannot. Okay. So can he dress on his own and take care of his toileting needs and cleaning needs?
No. Sometimes yes, sometimes no.
But he needs help. All right. And has he been having any behavioral problems?
Having what?
Any behavioral problems? For example, getting agitated, being aggressive, running away from home,
No.
being uncooperative.
No.
Has he been having any emotional problems?
Like what?
Like what? Like if his mood has been low.
No.
If he
No.
cries a lot.
No.
Has there been any problems? For example, that he's seeing things or hearing things which are not seen or heard by others?
No.
I would like to ask a couple of more questions, Mr. Joseph.
No problem.
Has there been any sleep problems?
Sleep? Yes, his
Yeah.
sleep is a bit disturbed. Sometimes he sleep 1 hour, 2 hours in the morning and night. I don't feel that he's sleeping regularly. 1 minute remaining.
So, Mr. Joseph, you mentioned that there has been certain memory problems that have been there for last 1 year that always deteriorates whenever there is stroke. And along with that, there are certain comorbid heart problems and blood pressure problems, which the medicines have not been able to control much. And due to this, he has not been able to take care of his daily activities on a consistent basis and requires certain help. Along with that, he has developed certain erratic sleep patterns. I just want to know if there has been any safety concerns with all these problems.
Yes, definitely, doctor. He sometimes he wanders and he got lost 2 days ago. That's why we decided to talk with the GP.
All right, Mr. Joseph. I think there is a possibility that your father is suffering from dementia, and that too vascular dementia. But for the same, we'd like to go for certain further history assessment and certain further tests. Will that be okay if I make another appointment for you for the same?
Very good. Time is over. Very good. So how do you feel about what you did?
So there, I feel difficulty. There is difficulty in expressing empathy and completing the task.
Well, actually, empathy can be in the tone. You don't need more than 1 or 2, 3 sentences, maximum 5 sentences. It is not a station of psychotherapy. You are not going to do psychotherapy for the patient. So you must pay attention that you should do empathy, particularly when the patient starts to talk, the very, very first early stage of the station, when he starts to express the problem which he is suffering from because of his father's condition. This is the best time in which you should show empathy. Okay, so let's see, according to this our PDF. So the first thing which you should do in a station of history taking, dear doctor, is to take the complaint, not go directly to the syndrome. So this man has memory problems. You want to know exactly when did this problem start and what were the circumstances during the onset, okay? And this is how you start the station. You don't go directly through the symptoms of dementia because you don't know exactly what is the problem. So this man has memory problems. So I would like to know more about this problem. When did it start? Anything happened at this time, okay? And you want to know the course. Is it increasing with time? What makes it worse? What improves it? And you will discover that what makes it worse is don't ask a medical jargon question. It is a stepwise fashion. This is a medical jargon. This is how we communicate with each other as doctors. But you can ask him, what makes it increase? If it is a vascular dementia, it is always related to an incident which is related medical problem in which the vascular supply of the brain is decreased. Okay, so this is how you ask about the stepwise. What improves it? There is no particular thing which can improve it, but this is a question which you should ask. Okay, first stating factors, you should ask this when you want to know what was happening before the onset. Okay. And if he has had trauma before, any depression and so on. And then the symptoms, the syndrome, which is the love map, this acronym of the symptoms of syndrome of the dementia. Okay, love map standing for the language, the orientation, the visuospatial, the executive functions, the movement, etc. But pay attention, doctor, when you shift from one area to another, you must have a signpost sentence to show where are you from the consultation. You don't just go ask questions and that's it. You must make me feel that you are in a different area. And this is the importance of the signposting questions, okay? A very important skill which show that you are organized and will help the consultant understand that you are now shifting to another area. Don't just stack questions. Okay, the comorbidity, I would like to check if there are any other associated problems. This is also a signposting question which you don't use. You ask about the signposting question. I ask about the psychological and the physical. But he always, as I say, the candidates forget the social part of the patients in general. So pay attention to this. I didn't feel that he asked about the social part and if there is anyone around him to support him. And regarding the risk, a very important question, how is the family coping with all this? A very important question, not him coping because he's not aware. Those who have dementia, their insight with their problem is not that good, but those who are suffering are their families. So you want to ask, how is the family coping with all this? Past history and family history, we know that there is a familial family issue, genetic issue in the dementia. Ask about the dementia in any family member. And at the end, you must deliver the diagnosis in an assertive way. From our discussion, it seems that your father is having dementia. Most probably, it is vascular, not Alzheimer's. Sorry, there's a mistake here. It is a vascular subtype. Vascular subtype. Okay, I would like to give leaflets about it, and I'm looking forward to see you again. Okay, sorry for this mistake in the PDF. Okay, this is how you do the station. And my only feedback is that start by the complaint. You show the empathy in the very first beginning. You said some sentences about the empathy, but it was very late actually, and it sounded awkward because it was very late. Daily living. And again, this signposting might give an impression that you are disorganized. Okay, that's it. Thank you so much. I will not go through the mark sheet. I went through it before, so just for time issue. Thank you so much. Who would like to go next?
Hi, good evening, Dr. Hossam. I'm Lishi. I'm Chong, so I would like to go next. My station is Alzheimer's disease.
Alzheimer, it is very close to the previous station.
Yeah.
Pay attention that this station can come as Alzheimer. And also there is another scenario for this station in which you are taking information from the brother of someone who has Down syndrome and also is having dementia. Very, very close information. Okay.
Okay. All right.
So now you have this story. So write down your notes, arrange your thoughts. You have 2 to 3 minutes. Let's see how you're going to do it. Okay, ready?
Yeah.
Okay, very clever. Let's see how you're going to do the station. When I say start, 1, 2, 3, go.
Hi, Mr. Charles. I'm Dr. Chong. I'm one of the doctor who is working in the mental health unit. I understand that you are here today together with your wife Sandra, together because you were referred for you're having some memory problem. So may I know how is going on?
Well, my wife has been very forgetful actually in the past 2 weeks, and actually the memory problem has been going for a while. But I discussed this with the GP. He said that I must talk with you.
I see. All right. So you mentioned that your wife is having some memory problem for how long? How long has she having the memory problem?
About 6 months ago.
6 months. All right. So what are what are the things that you observe in her? Like how is her memory impact?
Well, I didn't get your question. What exactly you want to ask me about?
You mentioned that she's having some memory loss. So what is the thing that makes you think she has some memory loss?
She is
Like,
very
she,
forgetful, doctor. Very good, forgetful.
I see. So do you mean to say that she always misplaced the item or she
Yes,
forget?
yes, yes.
I see. So other than that, what about her long-term memory? Like, is she able to remember about anniversary or birthday?
Well, strangely, she is very good with all the events.
I see. So she is just being forgetful and she can't remember the thing that she just done recently. Correct me if I'm wrong.
Yes, yes.
Okay. So I just would like to ask a few other questions to know further about her condition. So
Okay.
what about her attention? Her attention, like for example, is she able
I feel that she is not very attentive.
I see. Okay. Is she able to complete the task like she's on hand, like she can pay attention to TV or newspaper reading?
No, I think she needs support in many things, doctor. Everything she needs support in right now.
I see. Would you like to share with me like how is the thing she able to do now and what are the things that she requests?
She used to use the microwave. She used to have some sort. She liked to paint and have some, you know, these weaving issues. But she doesn't know how to weave now. She doesn't know how to do the knits as before.
Okay, I see. So correct me if I'm wrong. So she seems to be unable to complete some complicated tasks like
Yes,
involve
exactly.
I see. Okay. How long has this last? Is it happened over the past 6 months or it just occurred? I mean, like over the short
Well, it
period
is.
of
I cannot tell you exactly when, but it is going on and it is increasing.
I see. All right. So other than that, does she? I mean, how about her speech, her language? Is she able to tell you what she wants to tell,
Sometimes
or can you understand
she
her
struggles
speech?
with some words which are, you know, regular words like cup and table. I am
see.
shocked sometimes she doesn't know these words.
I see. Oh, I can see that there's a quite a difficult situation for you and her. So other than that, do you notice your wife, Mrs. Sandra, like she is unable to get the meaning of
What? The communication?
whatever people trying to tell her.
Sometimes she doesn't understand.
Yeah, communication problem. I see. Okay. Other than this, how about her function? Like, is she able to look after herself? Is she able to do her personal hygiene care?
Not yes, to some extent, yes.
I see. I just would like to know about her support. So is your wife she's staying with you? Who else is staying together with you and your wife?
Only me and my wife.
Okay, so you are the main caretaker for her. Is she able to prepare food for herself for now?
Yes.
I see. How about money or financial handling? Is she able to do so?
Well, no, because she lost her wallet several times, so I decided to take over all the financial issues.
I see. Okay. Does she still able to drive or use vehicle like motorcycling?
No. I took from her the car because she got lost, so I stopped allowing her to drive from driving.
Okay, I see. Thank you so much for sharing all the information. I just would like to ask a few others routine question. So other than memory loss and also some difficulty in handling things in life.
1 minute remaining.
Do you notice she has any change in behavior or anything else, like personality change?
Now, what do you mean by personality change?
That she become get irritable easily, or she get upset quite easily?
Yeah, to some extent, yes.
I see. Does she have any other medical condition?
No.
Okay. Thank you so much for sharing with me. So from the information that you share, it seems that your wife may have a condition named as, it suggests of dementia. It's likely to be Alzheimer's disease. And so I would like to arrange for another session so that I can get more information, and I may arrange for some tests and maybe imaging scan to know further detail about her condition. Would that be all right?
Okay, thank you. Time. How do you feel about what you did?
It's a bit disorganized.
To some extent. Look, I know that it seems that you know all the questions, but you are asking the questions and you are not able to group them in your mind in order to look organized. Okay, but you were asking everything, but not organized. Yes, exactly. I hope that you give her feedback. I don't know, they can stop giving feedback. Nobody. Okay. Okay, so nobody is having feedback for you. Okay, so don't know. It's not. You already are cooperative. Let's see the film. Sorry, I closed my PDF. Okay, dear. So let's see how we can do this station. So, first of all, doctors show empathy when you start to hear the complaint. This is the best time in which you show empathy. Okay, very important. Okay. You are not required to show empathy 100 times, and it's not just show empathy in the appropriate time. And the best time for showing the empathy is in the very first beginning when you start the complaint. Now, the complaint is an important, maybe it is the most important part in the history-taking task. It is not the symptoms of the syndrome. So you must ask about the onset. When did this start? Was it on sudden, gradual? Anything happened at this time? So we want to know more about the onset. Is it increasing? What makes it worse? So you'll discover that there is nothing in particular which makes it increase. It is just increasing. And this is what makes it different from the vascular dementia. Okay. Precipitating factors. So you want to know how was she doing before that? Because sometimes the patients have precipitating factors like head trauma, depression, the type of sedentary life. Okay, very important to check for this. There is a particular pattern of life which makes the patients more prone for dementia, like minimal social and physical activities and isolation. Okay, so this is how you start, and by taking the complaint. I didn't feel that you took the complaint. You went directly checking for the symptoms of the syndrome, which is the dementia. And make sure that you differentiate between the symptoms of the syndrome, which are the symptoms which will help you to diagnose dementia, and the risk factors. I feel that most of you just amalgamate the risk factors with the dementia symptoms and signs. Now we have this acronym of Love Map, which will help you to remember the symptoms of dementia. And signpost, I would like to know more about her memory problem or his memory problem, then check the language, etc. All the items of the memory, all the items of dementia, and then check the comorbidity, and then check the impact and coping and risk, which is very important. And as you can see, they are the same set of questions like the vascular dementia, very close, okay, to the same set of questions. But signpost in order to appear more organized, and don't mix the risk questions with the symptoms of the syndrome. Okay. Impact and coping and risk, the ABC, you can have a look at them, the A, B, C, D, E, F, G. The most important is the F, falling, fire setting, financial issues. Other are also important, add 1 or 2 to the F, no problem. Very important to ask about the coping of the family with her problem or his problem, and finally delivering the diagnosis, which you did. Okay. I will not go through the mark sheet, doctors, because of the time issue. I'm very tired. Thank you so much. Very clever, by the way. Don't get frustrated. I'm trying to give you feedback. I feel that you know the questions, you know everything, but you need to be more organized. Use the signposting in order to make sure that you are passing, and to show that you are covering a new area. Show this to the examiner. Thank you so much. Okay, so who would like to go next? Have we finished? Hi, Dr. Hussam. Is it possible to download your material? Yes, it is on my website if you want to buy it, but unfortunately, nobody wants to. You prefer to circulate it among you. Okay, what can I do? It is on my website. If you want to buy it, it's okay. Eventually, no one can prevent someone from circulating any material. On my website, www.tasktutorials.com, you'll find all this PDF on the website. So who would like to go next? Okay, thank you so much. I hope that you found it helpful, and good luck. And I hope to see all your names in the pass list. Thank you so much. Have a good night.